Good morning, everyone. I'm Senator Robin Tucker, and today I'm going to give you a few highlights from our recent Senate budget debate. Starting with the Ministry of Social Development and Seniors, I would like to let you know that the protection against seniors abuse still remains somewhat problematic. Concerns about increases in senior abuse in pretty much all the categories was observed, but most notably, there is an issue with financial abuse, and that number continues to rise. We know that the National Senior Strategy, we've been told, is coming. It has been a year in the making. And as well as the Office of the Public Guardian, that initiative is still yet to be rolled out. But these things are not happening with the sense of urgency that is required to ensure that we have the optimum amount or optimum level of coverage and protections for our seniors. The second point that I would like to make relates to residential treatment services for children that are younger than 12 years old. So currently residential treatment is available. Residential treatment facilities are available for children that are 12 years and above, but not 12 years and younger. So when asked what services are available, since the closing of the Sunshine League, there are none. So what happens to children currently is that they will have to go into foster care. Now, we've all heard the calls for foster parents. So the question still remains, what happens to children when you do not have a sufficient number of foster parents? Another concern was regarding the psychoeducational program. So as we all know, has been reported in the media, tens of millions of dollars over the years have gone to overseas facilities. And this year, $2,108,000 has again been allocated to send children to therapeutic schools. However, when I asked the government to break down for us the amount of tuition that was going to each of those schools for our children in this fiscal year, they were unable to say. I will say to you that I did ask them and make clear that we were not asking for the names of schools, because obviously they will consider that to be confidential. However, no confidential details were requested. On the Ministry of Health headquarters and Department of Health, one initiative that they spoke about, that the government spoke about recently in the media, was the Mangrove Bay Clinic. We did learn in Senate that they don't expect to have that clinic operational until a couple of years, at least 2 years time. So if anyone's looking forward to having a clinic in Mangrove Bay anytime soon, it is not going to happen. Staffing in the Ministry of Health headquarters, we learned that there are 54 vacant and funded positions. The ministry has been rotating staff rather than filling these positions. Again, it is particularly concerning because, of course, we need in this country efficiency in healthcare. And so how can we have that efficiency when we have so many vacant positions? And certainly the issue about rotating responsibilities is also problematic, particularly because we've had so many people in healthcare that have been on the front lines of COVID who are experiencing burnout and stress and all of the things that go along with being fully stretched in delivery when you're delivering services. Professional services within the ministry budget hand. I'd asked a question about whether the government was being realistic in their budget requests, particularly because I noticed that there was a consistent trend with overspending. So they are requesting one amount during the budget year, and then they're reporting actual amounts that are, or revised amounts that are sizable differences. So the question really became, why is that happening? And of course, one of the responses was that it was due to COVID. However, I did point out that I had researched prior years, back as far as 2017, 2018, obviously pre-COVID, and that trend was still evident. Ministry of Labor and Economy. On immigration, there was questions about staffing. I was told that there are 13 vacant and funded positions within immigration, and also that the airport was fully staffed. Now, we had heard earlier in the week in the Ministry of National Security that retired customs officers were being brought in to assist with immigration functions to allow customs to do what they needed to do. So the question then becomes, the government has said that they are fully funded, fully staffed at the airport, but then the question is, why do we have retired customs officers coming in to do immigration functions? Work permit automations project was announced to the public in 2021. However, we still do not have a go live date. So again, efficiency in processes in work permits is of paramount importance. We know that for IB purposes, we know that for general economic purposes in terms of businesses being able to have staff on island in a timely fashion. So if we're going to increase our population by anything close to 8,000 people, we need to get that work permit process, automation process sorted as quickly as possible. Another concern that came out of that is that the minister considers work permit applications. And of course, we will have seen in the media where the minister did tell us that. However, the concern still remains that if there is no longer an immigration board that considers those applications, because the minister does it all. So if the minister is doing it, the process used to be that the board would consider the applications. If there was a refusal, you could appeal to the minister. But this begs the question, who do you appeal to if the minister is vetting and approving the applications or refusing them? Who do you appeal to? Thank you.